Hi, welcome to Happier Home Diaries once more, and thank you for keeping there, tuning in. So today we are talking about babies and colics. So what are colics? Most of us are familiar with colics because I've seen people calling and saying about colics and all that. So somehow we are familiar with colics. And so colic pain, it is pain that is illustrated by a baby through crying, whereby the baby cries for more than 3 hours a day. The baby will be crying at the same time during each day, and also the issue could extend for more than even 3 weeks. Mostly this issue starts as from 2 weeks old, maybe from 2 weeks and 3 weeks and later, and it could end probably by 12 months. So colics are quite disturbing. It is a hard situation, one of the hardest situations for a mother or a parent to handle after delivery. And so we want to see what causes colics. And colics, the main cause is not well defined. It is not really clear, but there are some causes that could trigger it to happening. So one thing you have to know is that colics are not abnormal or diseases that cause your baby to have an abnormal growth. And so we want to see what could trigger colics. So number one, the baby could have ingested some gas while breastfeeding due to maybe poor attachment or maybe some issues with breastfeeding. And so if baby had ingested some gas, they could have colics. Secondly, we could have some just due to immature digestive system. So you find the baby is unable to digest milk very fast and it remains in the abdomen or in the stomach, and this milk maybe could ferment and affect the baby. Thirdly, we could have some maybe the baby has taken some formula milk that could affect the baby, and so some babies are allergic to lactose and they get some intolerance, and so this could cause. Also, they could get the allergy from the food that the mother eats. Remember, you're eating and the baby gets direct from the breast what you take. So allergies from breast milk or from what the mother has eaten could cause colics. Thirdly, we could have irritation due to noise or a bad environment. The baby could all too much light. Some babies are irritated by too much light. So irritation from those things would bring issues. Are some of the causes of colics. So we want to see what are the signs that this baby has colics. Remember, a baby could cry due to another reason apart from colics. So if you want to know that your baby has colics, number one, this baby could be crying at the same time each day. So you find the baby cries at the same time every time, and this cry could be uncontrollable and it should not be related to wetness or hunger. Remember, the baby could be so hungry and also wet. Some babies are simply highly irritated by that. So if this baby is not hungry and cries at the same time, and this crying could also be not controlled by anything. You could try to breastfeed and the baby just refuses to breastfeed. It could be just uncontrollable. So also, colic pain causes the baby to just arch their back and fold their fists and have their legs crawling around. That is rolling around and so tightened. So this is a sign that this baby could have colics. Also, when you look at the abdomen, the baby could have a swollen or a very an enlarged abdomen. It could be distended abnormally, and probably it could seem like a gassy distension. So remember, these are some of the signs that a baby has colics. And so now we want to see about how do we handle this baby who has colic pain and whom we have confirmed that has colic pain. So this baby, what they require is one, taking away irritants. If you sense all you can do is monitor this baby and know what could be among the few causes that causes this. Maybe look at when it started, what made the issue start. Maybe it could have been something you ate, and from that day something new you ate, and from that day the baby starts those issues. Secondly, it could be happening always after meals, so you want to check, could the baby be reacting with something. Check also on your breastfeeding techniques. Breastfeeding techniques is, does the baby hold the breast or the nipple well? Remember, when you're breastfeeding, the baby should hold the nipple with their mouth very comfortably, and it should hold even almost to the complete part of the areola, that is the black part of after the nipple, should be inside the baby's mouth. Remember also that the baby should not produce sucking sounds. That is sounds that show that the baby could be pulling in some air, and also could be poorly attached to the breast. So you monitor this kid, check on the irritants. So when this baby has started having a colic, remember the abdomen could be distended, and it should show that the baby has some gas. So what you do, you fold the baby's knee and turn the leg towards the abdomen, and then you could just play around with those legs and let them play around and exert some little pressure on the abdomen, and this one causes the baby to get some relief from colics. They could also pass gas or even a stool or anything that could be trapped inside and bothering the baby a lot. So ensure you just tilt those legs and do a bit of like a massage on the abdomen with those legs, and just let the baby be comfortable. Remember to talk to this baby, just talk around, sing along to this baby. Some babies are soothed really well by music, so you can talk along and just let the baby feel and hear the voice of talking. Remember, you can also rock the baby. Some babies are okay with rocking, just you can dance along with them. If you have a baby rocker, you can place them there and let it dance around and shake them around. So it is also a good way of relieving colics. Take a bath, it's another thing. Some warm water. Taking a bath is a good way of relieving colics. So you can bath the baby with some warm water. Ensure the baby gets inside the basin, just leave the head out, and the baby just feels a bit relieved being inside the water. It helps. Another thing you can do is to just stroll around. If you have a baby stroller, just let the baby stroll around. If you have a car, you can ride around. If you have none of them, you can just walk outside with the baby. Sometimes just seeing outside could make some babies feel better. Those are some tips and techniques of making a baby feel better. Remember, you can also burp the baby. The baby could be having gas that could be expelled and the baby feels better. So you just hold the baby upright and burp the baby. So next is just holding the baby upright, changing the position in which they are sleeping in. It could help, and hold the baby upright. Another technique is that you can hold the baby on their stomach, let them be on their stomach, and then place them on your thighs, and then rub the back of that kid and play around and just shake your legs a bit, and the baby feels, some of the babies could get better with that. If it persists and none of the techniques are working, you can see your doctor, and let your doctor prescribe some medications and some maybe grape water or any other medications that could help to relieve the baby's gut. Remember, if your baby is taking formula milk, your doctor can also advise you on some non-allergic milk. Some babies will react to cow's milk, and they have some cow's milk allergies. And so we have some milk that can make the baby not feel bad. It's non-allergic. This is called NutriPepti. It is from Cow and Gate company. And so this NutriPepti is a good milk. And if you have babies that take milk, formula milk, this milk is non-allergy milk. It has no allergens, and 97% of the babies that were given this infant milk, they got better and were relieved from colics. That is with the babies who are taking formula milk. So See your doctor if your baby has the following signs. There are signs that could show it is another issue that is causing the baby to have to cry a lot. So some of the signs are fevers, if the baby has fevers, and also if the baby starts sleeping a lot. The baby now ends up sleeping too much, and that is a sign that the baby could have an issue. Any difficulty in breathing, that it could be shown by maybe using the chest so much when breathing, and also you find the baby breathing so fast, too fast, faster than you had seen before, or just wanting to sleep most of the time with some moments of crying and crying a lot. Also, if this baby is not gaining weight, or not feeding, or vomiting everything, not retaining what they take, remember these are danger signs and they should be reported. So ensure you see your doctor and get your baby treated. I wish you all the best, and I hope that you are able to handle colics, and may you find a lot of peace in raising your infant, and may colics end soon. Thank you, see you next time, and thank you so much for following. Remember to subscribe and keep following, keep liking and asking those questions. We are bringing them right at your door. Thank you so much.